Thank you, Judge, and thank you for your leadership, and I look forward to continuing to work with you on a situation that's going to be with us for several weeks, if not several months. Let me just start off by certainly acknowledging Mayor Pro Tem Martin, who's with us, and Vice Mayor Pro Tem Martha Kestek Tatum, Councilmember Jerry Davis, who is here. And then Cameron James is also here, who's president of the Houston Restaurant Association. And thank you, Cameron. We've had several conversations during the course of the day. Let me just start off by saying City Council will meet in a special call emergency meeting on tomorrow, March 17th, to allow us to continue to extend a proclamation of a local state of disaster due to a public health disaster for the city of Houston beyond the 7-day period after the proclamation was issued, and making certain findings related to and providing for severability and declaring an emergency. And that meeting will take place tomorrow at 9 a.m. In addition to that, we will extend the date of all city produced, sponsored, and permitted events that were postponed through the end of March. We will extend that through the end of April. And we will further suspend all proclamation presentations at City Hall on Tuesdays, which is normally at 1:30. That will be suspended through the end of April as well. And all of our meetings will be limited to 50 persons. Let me just start off, also add, none of these decisions that we're having to make are easy decisions. They're simply not easy, especially when you recognize that when you're making a decision, you're impacting people's livelihood and possibly people who will be either laid off or lose their jobs as a result of the decisions that are being made. I will tell you that it is important for all of our governmental entities in Houston, Harris County, surrounding region, and quite frankly across the country, to act as much in concert with one another, because our boundaries are very porous. People are traveling from one destination to another. Last night, of course, when the CDC issued their new guidelines limiting or recommending that the limit be 50, it did change things. And so we started making adjustments, trying to get a read from where the CDC was and where people were on the federal level. And then, of course, just today, those guidelines shifted from 50 down to 10. So things are very fluid and things are constantly changing. I will tell you that as it relates to the largest cities, for example, in the United States, New York, Chicago, D.C., they have already taken action in terms of closing or suspending business with restaurants and bars and clubs already. Houston, of course, will be the fourth city of the top 4 in doing that. And the period of suspension for us, as the judge announced, will be 15 days. And the goal is very direct, and that is to slow down the progression of this coronavirus, COVID-19, so that it doesn't overwhelm our healthcare system, to flatten the curve. That is the goal. And these are tough decisions that have to be made. But from what we are getting from all of the medical experts and people that are advising, that if we don't take definitive action now, all of us will pay a much greater cost down the road. And that's the focus, that's the goal. They're not easy decisions. We certainly recognize that we will be impacting people's lives, people's businesses. So that's simply the consequences of what we're having to do based on what the facts and the science and what's being presented to us. So we'll continue to work very diligently to get this situation under control, and we just encourage people to continue to do their part in minimizing being a part of large gatherings, groups, and in large part, people are already doing that already. But what we did notice for example, over the weekend, that in a number of these places, there were huge crowds and people were not respecting social distancing. And that's an important part of this situation. I know Dr. Shaw and Dr. Purse will talk on testing. I know you're anxious to hear about that. So let me just pause and yield to Dr. Shaw. And what I would add, Dallas has already made the decision. Austin is looking at making that decision later on today. So other cities are looking at doing the same thing. I think what we all recognize is that it's important for us to operate in unanimity as much as possible. Take, for example, if we didn't take any action, and let's say Dallas has already moved, then you have a lot of people who are not in college. Schools are out, spring break time. People simply then leave one jurisdiction and then come to another. And what we have seen in the city of Houston, in Harris County, in Fort Bend, for example, is that we've had a lot of cases positive based on people traveling from one jurisdiction to another. And now you have a situation in which New York, Chicago, LA have taken very definitive steps. Those are the top 3 largest cities in the country. We are number 4. And the reality is that if we could close off our boundaries, if we could stop people from coming into our region, that would be one thing. And then I will tell you, yesterday we were at a different position. You know, I know when we were asked the question, and when I was asked yesterday, was very reluctant even to move on our restaurants, bars, and clubs. Same thing with the judge, very reluctant. But you had the CDC made its pronouncement last night, and that was an abrupt shift down to 50. And then the president made even reduced the number even 10. And in his pronouncement today was saying to restrict people from eating establishments and other institutions. So everybody is trying to operate in concert. That's the only way really that you're really going to hold down this virus, slow down this progression, is that if we operate in concert. And these decisions are not made easily. I mean, we've been talking with the the Restaurant Association today, and it's not an easy decision, because when you make a decision and a decision that may cause someone to be laid off, that's not a tough call. This is not a lockdown. Okay, let me be very, very clear. This is not a lockdown. What we are attempting to do is to be very measured at what we need to do to slow the progression of this virus so that it doesn't overwhelm our healthcare delivery system. And let me just say this. Neither should people expect government to tell them what to do on every single thing before they do what's right. Government shouldn't have to tell you what to do. And a lot of people are looking for government to tell them to be responsible. So this is not a city or county lockdown. These are very measured steps based on what we are seeing that are needed at this time to slow the progression. But if you are going someplace and you see that you can't have social distancing, then you need to step out of there, okay? So people still need to act responsibly, and individual judgment is always good. But these are very measured steps, because every time we take a step, there are going to be impacts on people. So we don't want to go and I don't think people should look to government to tell them every single thing that they should or should not do. We are taking some very measured steps. People still need to exercise their own judgment and be responsible.
What about mass transit, Mayor? Anything with mass transit, anything different like with the mass transit?
Well, I think, and Metro, for example, is working on helping with the social distancing, but we also recognize people need to utilize mass transit, because there are a lot of people that don't have cars or trucks, and so they need to use it. And that's why I'm saying, there are some things that simply will have to take place because people need to get from point A to point B. And we're mindful of that, and we're very sensitive to that. And let me encourage people, take out, pick up, delivery, take out, pick up, delivery. In talking with Cameron earlier, that's Cameron, president of the Houston Restaurant Association, and I certainly want to acknowledge them because we're talking a lot about compliance. But let me say to you, the restaurants in our city, in our region, in the county, they want to be partners. They want to be partners. And one of the things that they did ask for example, is pick up, take out, delivery. That's important. And so, that's one way we can be supportive. And then on the federal level, the bill that's making its way through would provide assistance, for example, to those businesses, I think with less than, I want to say 500 employees. So that would be a big, big plus.
Make